So you may or may not have seen our little vignette on squatting, so you might want to check that out. But this is kind of like a little more information about some exercises that you can do to optimize the baby being able to travel through your body, through your pelvis, to be able to have a natural birth. So some of the things that I've noticed is that a lot of women, we sit all day long, whether it's our work or whatever we're doing. And so what happens with that, if we don't respond to it and try to counteract that, is our muscles actually shorten right here, which will result in, I'm going to show my pelvis. If this is our pelvis, if you're sitting all the time, these muscles and ligaments start to shorten and it causes the pelvis to do this. But when that happens, what can occur is when a woman's pelvis is either this way or if it's tilted this way, actually when she stands up, because they're contracted, it will cause the pelvis to do this. So what that does is the baby doesn't enter the pelvis properly. It can actually kind of do a little headstand on your pelvis, on your pelvic brim right here. And that can cause some problems or prolong the labor. So what we want to do is stabilize your pelvis, right? And so I'm going to talk about some positions you can do. And also I really want to encourage you to contemplate seeing a chiropractor for during your pregnancy, well, anytime, but someone who's accustomed to working with pregnant women, and it can really help they can work with you to really stabilize that pelvis. So I'm going to show you a few other things that I would like for you to do. One is utilizing this stretch for the hamstring stretch. So that is just doing this. You can do it at home. You can do it standing at the kitchen. You can do it if you're having a break from work, whatever. But hold it for maybe about 15-20 seconds. If you can do it a few times a day, even better. Other things are that women during pregnancy complain of a lot of sciatic pain or pain back in here. And one of the stretches that you can do is this. It's so you're going to cross your ankle over your other knee and then basically straighten your back and fold forward. You're going to feel a nice stretch along your backside, on your bum there. And that, if you could even hold it for like 15-20 seconds and then switch to the other side. If it feels good, you can do it a lot. But again, this is going to help to make sure the muscles are released in the front and the back so that your pelvis is aligned. Other things are any kind of hip openers that you can look up, like even doing, it's called the cobbler's pose, where your feet are together and you're releasing out your thighs this way is really good too. And so all of that will be really great in helping you to open up your pelvis and make optimal positions for the baby to come out. Have a great day.